Chat is disabled from somebody. Okay. Thanks, Erin. Welcome. First of all, we have just under 300 people registered for today, which is exciting. We all personally and in our work know that this topic is important. So thanks for joining. If you haven't muted, I think all attendees are automatically muted, but any of the panelists, if you can, please go ahead and mute yourself. You're in seminar 1. This is the seminar series on climate ready housing for tribal elders. We also say in older adults because much of what we're going to cover in this series applies to any adult. And I'm going to go ahead and get started also because the majority of attendees today are tribal, but we also have a lot of our government partners, state and local health agencies. So providing this goes well, I am going to run a quick poll here. And if you'll just take a minute and answer which, and if you slide down, there's multiple different options there. If you'll go ahead and just answer where you're from. Just about everybody. All right, I'm going to go ahead and close the poll. I think we're just about there and share the results. So I don't see, Eileen, do you see the results? Because I'm not seeing them on my end. Is it showing up?
Yes, it is. It's
fantastic. Okay.
Read them to you?
No, that's okay. I'll be able to download it. Basically, I want anyone on the call to see who else is here for future networking purposes, people within your tribal regions or other tribal departments. The heavy distribution of this was intended to get housing, environmental, air quality, community health, public health, tribal partners, agencies, because this is such a complex problem and requires all of those agencies. So I just wanted to go ahead and share that. I am now going to go ahead and get started because I'm going to do some introductions and get us going today. Let's see here. All right. First of all, just who we are. The Tribal Healthy Homes Network is the primary host today. It's also hosted by the Partnership for Air Matters that focuses on resident education. The Tulalip Tribes is our longtime host, our advocate, and our partner in all our work. And EPA, specifically EPA Region 10, has been our longtime fiscal supporter and partner in the work we do. Over the next 4 months, we're going to cover extreme heat, wildfire smoke, infectious disease events, and precipitation events. Don't worry, you haven't missed any other announcements. The specific dates are not set yet because we're trying to line up an optimal speakers for each of those topics, but you will get an announcement 3 to 4 weeks before they come out. So today, again, I'm not going to read this, but I wanted to show you who we get to hear from today because we have some fantastic speakers. Dean Henry is going to give us a welcome. I'm going to briefly talk about basically the landscape, the why we're here discussing this. Our keynote is Dr. Andrew Chang, who's going to give us a fantastic insight into sort of the mechanical underpinnings of why elders are at risk during heat events, specifically their cardiovascular health. We'll hear from Ashley Schmidt, who is an outstanding partner with us at Tulalip, and she's going to be talking about risk communication with tribal elders prior to and during heat events. Then we're going to get into the mechanical and wrap up with Eileen Gagne, who will be talking about retrofits, upgrades, technologies, essentially what is available to try and mitigate the effects of extreme heat in the residential setting. She's also going to talk about where the IRA funding aligns with this because this is a very important moment in time. We hope we can all come in under this time so that there's time for discussion. But if not, at the end, we're also providing all our contact information to follow up. All right, just really quickly, the series objectives, pretty straightforward, but I'll go through these very quickly. First and foremost, we want to bring attention to why elders are vulnerable inside their homes during climate events and really understand from the health perspective. We also want to explore coordination strategies because if you're like me, you're now working increasingly across departments and programs, housing, healthcare, emergency response, environmental programs, tribal managers and leaders. And the same may, if you're a local government or housing advocate, you're probably doing the same. So we want to continue to promote coordination. And then finally, really, we want to accelerate the adoption of housing retrofits and upgrades by disseminating best practices and links to funding. All right, Dean Henry, I like to say he is leading our canoe. I'm not going to read all our bios in depth today based on the time that we have. So what I'm going to be doing is just putting the bio here, let you read that for a moment. But I've also put full bios for each of our speakers today on the seminar series landing page. But with that said, Dean is going to give us a 2 to 3 minute welcome and introduction because he is, I think, one of the most important champions I've met and who's influenced my work, and I want him to give us a kickoff. So Dean, could you go ahead and hello, yeah, and I'll turn off my video, I'll mute and go for it, Dean.
Good afternoon, everybody. Thank you for inviting me to the seminar, Gillian. One thing I come to work every day, and over the years, since we started this back in 2013, and then before that, when I met Gillian in 2005, we worked on a little bit about this mold mediation and all this stuff. But 2013, I wake up every morning and I pray for our people out here because, our children are suffering, our parents are suffering, grandparents are suffering. Because we have I believe, over 250 HUD homes out here. I imagine it's a little more than that. But, these HUD homes are built on wetlands. And so over the years, since they started 1985, when they started building these homes, because I know how wet they are because I used to be a logger for the tribe. And we logged out these areas where they're wetlands. And so what they did is built these houses and then added dirt, tons and tons of dirt. And then they built these houses and found foundations. So here we are 30 years later. And so over the years, we have mold in these homes. And so these kids are the young adults and grandparents now, they're have some kind of asthma and mold in their homes. And so we've been dealing with this for quite a while now, and so we've been trying to get these grants, but we keep missing on these grants out here. But in the meantime, our people are suffering out here, especially young kids. I hate to see young kids suffering all the time. I see them out there playing down the youth center, and I hear them coughing and their nose are running, and it's kind of, you could tell they have some kind of a problem with their chest or some kind of bronchial going on with their their bodies, how heavy they're breathing. I can see that. But anyway, it's all the years of deterioration with this water underneath their homes, because 80% of the reservation is clay up here. And so what we have is, when they start building these homes, they're just paying for it now. And we've been trying to, housing's been trying to get grants for years, but nothing's, come about it. So we really hit hard in 2013 when I called Gillian. And so we've been missing, and the board, we met monthly for years, and they just kept, kind of looking at us like we're nothing. But now, since they come to, here we are in 2023, we had a general council back in April, and this is when I was brought up on the floor. And so finally, now they start listening to us. Now we're getting more, housing's getting more involved. And so we're starting having these meetings. And so, they brought on somebody who was a mold specialist, but they don't get this involved. And so we're just, trying to stay involved in this. And, we just have to keep going, keep paddling our canoe, because we're not going away. As I told some of the board of directors, we're not going away. And I met with one of the board directors the other day, actually two of them in the boardroom, and they know what's going on, and they don't want us to back off. And they want to go full steam ahead on this, but still, where's the grant money? I mean, I built these homes, and here we are. We're paying for it. Our kids are paying for it. You know, even the young adults are paying for it. I'm paying for it. I paid for it a long time ago, living in an old government home back in the 50s. Now I live with bronchiectasis because of the government home we lived in, because that was full of water. And now it's full of, we lived in that house for 7 years, and I can remember throwing rocks at the rats underneath the house. They were my buddies. I chased them around, running around, getting all wet underneath the house. And here I end up with whooping cough in that house. You know, I finally tore them down back in 1965. But still, here I am paying for it. I'm on, you know, on albuterol. I'm on the machine. Now, 3 different types of sprays and pills, and I exercise every day to, you know, keep my lungs clear. And when I have an asthma attack, a bronchiectasis attack, I have to stay home because I hurt, my lungs hurt. So this is why I'm hot and heavy on this, you know, on this healthy home stuff. Because I hate to see young kids, you know, get like I am today. You know, my lungs are, you know, deteriorating. But, you know, that's me. But these young kids now, they just, you know, these hot homes are, you know, they're paying for it now. I mean, just outside of these homes, you could see how bad they are, you know. So anyway, I just wanted to say a few words. I appreciate you thanking and Gillian and inviting me to this meeting. Anyway, that's what's going up here at Tulalip. We have a major problem up here because 80% of the reservation is clay, and you know, and we got to do something about it. And it's taken a long time to keep paddling these canoes, you know, but we'll keep paddling. Thank you.
Thank you, Dean. And you know, Dean's speaking about mold. Today's about extreme heat, but what he's really seeing is the condition of the homes and the fact that there's been not enough funding over the years to remediate as needed. And now we have the climate crisis. So I thank you, Dean, as always. And I'm going to go ahead and share my screen and go back to our next section. Let's see here. All right. And go to, sorry, you guys, it's not, you know, there's never, ever a glitch without it. For some reason, I can't, let me just drag this out of the way so I can go to whole screen. All right. I think we're good to go. I'm going to take about 6 to 8 minutes right now and talk about the why that we're here, sort of the landscape. And again, my name's Dr. Gillian Middlestead. I think you'll see my bio, but I've worked at length over 30 years with the Tulalip tribes, and they continue to be a place where I do much of my field work and appreciate the opportunity with Tulalip in their hosting of my other organization, the Tribal Healthy Homes Network. And again, this is just a slide with photos. The full bios are in the seminar landing page. What I want to talk about very briefly is that climate events have become a risk multiplier. And in my small field of working on indoor air and healthy homes, we had all these pre-existing hazards, mold and radon and lead, asbestos, volatile organics, wood smoke extensively. And now we have climate events that are a risk multiplier. And as you can see from the titles here and the visuals, it's pretty self-explanatory, but essentially in almost all states now, we have any combination of wildfire smoke, extreme heat, infectious diseases, all of which, of course, are creating other exposures that occur not just outside during these events, but we are being exposed inside our homes. And if we're in a substandard home, there can be an accelerated exposure. The challenge, though, is that at the same time as climate risks are growing, we're becoming more inclined to want to stay inside our homes. Our homes are a refuge from the heat, from the smoke, from the precipitation, from infectious disease. And ideally, our homes would be a safe refuge. But the major environmental inequity going on is that most homes in tribal communities, many homes built with insufficient federal funding over time, are not a safe refuge, and they're exacerbating the risks. Elders specifically is the topic of this entire seminar series because they are by far our greatest community resource, and they're at the highest risk during climate events. In a recent presentation, I asked everyone, and I don't know if you're can raise your hand on this, but I asked everybody and I said, how many of you would not be who you are today if it weren't for a grandparent, or may not even literally be here and figuratively because something a grandparent did? When I presented this before, the vast majority raised their hands. I can't see the hand raise feature right now. I see what Kathy Moses did. Thank you, Kathy. The point is that they aren't an elder or a senior or an aging adult. They are the lifeline that created us, and to keep them around so that they can do that for other grandchildren. That's what's critical in our conversation today, I think, at least from what I'm observing. So very briefly, a few data points. In Washington State, where I live and where I work, I'm going to share two recent data points. I'm sure you see, if you're in social media or the mainstream media, we're now learning a lot about the mortality. But really briefly, I'll just share two that to me tell the whole story. One is in Washington State, as you can see here, over an 11-year period, they looked at the mortality that occurred during these smoke events. As you can see, from age 65 to 84, half of all deaths during that time were in that age group, and another 32% were over age 85, essentially meaning that the vast majority of deaths during smoke were in elderly adults, older or elderly. Then Washington State also had data, and I'm sorry, the citation isn't too fine a font to see, looked at the percent of heat-related deaths by age over a 1-month period. And the pattern is quite similar, as you can see here, which is, again, if you look at ages 65 and older, we have 47% and then 20% over age 80. So I think these data are replicated throughout the country and probably in your community, and they tell us the story. All right. But the question is, if there's higher mortality among older adults during extreme heat events, where is their exposure occurring? Is it outdoors? Not likely. As we know, the proportion of time older adults spend inside their home is very high, something like 22 hours, 21 hours, which means that the home, that residential setting or adult family home or long-term care facility, is the place where we need to focus on reducing harm, in particular because we can't mitigate the outdoor environment. There's also upstream factors, like it isn't just that being in a home and being older, it's all the upstream factors that contribute to excess heat exposure and adverse health outcomes in homes. So number one is just housing affordability is a factor. As you can see here, about 38% of American Indian Alaska Native households were cost burdened. What that means in practical terms is that you may have to make a choice between using air conditioning or paying another utility bill or paying for food. So that compromises the safety of the household. Housing condition is a factor. As you all know, the conversation around HUD homes has been going on for a long time. There's significant HUD input and funding now, but by and large, we still have a legacy of homes with a variety of different deficiencies, which means they may be less likely to have adequate air exchange, filtration, ventilation, and cooling. And then economic conditions are another upstream factor. There's almost 20% of American Indian Alaska Native adults, 65 or over, live in poverty. Again, that drives that issue of, can you afford to do a retrofit yourself to your home? Can you afford to play that air conditioning? Not likely, or to run your air conditioning. Then who's in those houses? So if you have a substandard house with inadequate cooling, is it a young, healthy adult? Maybe, but in many cases, it's an older adult with an underlying condition that elevates their risk. So almost all elders, Native or otherwise, have a chronic illness. Almost 80% of people over 55 have anywhere between 1 and 4 chronic illnesses. American Indian Alaska Native adults are 1.5 times more likely to be diagnosed with coronary heart disease. That's another webinar, but food deserts, access to traditional diet, subsistence diets, there's a lot of factors behind that. Likewise with the epidemic of diabetes. So now you've got a combined of housing deficiencies, substandard, extreme heat, and someone who lives in that house with an underlying health condition. I'm going to go through this slide. I'm not going to read these next two slides. What I wanted to share is this particular researcher in the left-hand column. What you can see is a list of all the types of health conditions that are aggravated by climate change, from infectious disease to cognitive impairment, renal and urinary illnesses, medication side effects, stroke, exacerbated diabetes. But I share this because if you scroll over to the right and you look at the right-hand column, what are the aggravating climate change impacts? Everywhere where I have put that yellow circle is showing that extreme heat is shown in the scientific literature to exacerbate or induce the conditions over on the left. And as you can tell here on page 2, that's a very long and robust list. Looks like one of my yellow circles fell out of place, but I think you get the idea. All right, really quickly to wrap up before we jump into our keynote, and I got to do a time check. I'm 2 minutes over. We've been doing community-based research. I want to share this with you because it really says, I really want to understand who is working on this, what are they doing, and what can we learn from them? So last fall, we had a tribal survey. We had 59 different tribes respond, and we asked what kind of risk mitigation event actions they're taking during a smoke or extreme heat event. If you look across from left to right, you can see that everything from distributing air conditioners, air purifiers, the DIY fans, setting up a clean room or a clean airspace. Of course, the dominant here, 26% responded that they're distributing air purifiers. This is really exciting to see all this work, but it also shows that if we're having to do all these things, it's because the home has deficiencies, right? We would not need to distribute air conditioners or air purifiers or DIY fans if the homes that our elders and aging adults lived in had structural and mechanical mitigations so that they provided adequate cooling. So I think there's a story in this slide as well. We also asked about risk communication. We also just wanted to know how we're reaching out, what are the different channels tribes are using. Of course, social media is key. The story behind this slide, though, is that we need to use housing, elders programs, bingo, social services, community health, because we all need to hear it from anybody we trust and interact with, right? About the dangers for heat, and we can reach elders multiple ways. And finally, just really quickly, we've been doing some research with the Tulalip tribes. We're in Western Washington, a very moderate climate, but that is changing. And it looked like almost 65% do not have a whole house air conditioner. And so over half are using a window installed air conditioner, which is expensive and sometimes ineffective. I asked about a heat pump. The majority, almost 70%, said no, they don't have one. And as a result, many were using a box or a floor fan, 55%. That also points to the fact that people are having to use adaptive mechanisms to cool their home. We're getting to a point where those small adaptations are no longer going to be sufficient for safety. And then finally, I just want to close by my comments by saying that I also asked about how likely would an elder be to want to call someone and say, could you come set up a clean room, either cooled or filtered, a smoke safe room? And it looks like 46% said they'd be likely, 17% very likely. So there was a lot of support for that. In contrast, we asked, would you want someone to pick you up and take you to a community place with filtered, clean, cool air? Almost 70% said no, they would not be likely to do that. This is, again, really important because it underpins the idea that most of us, including elders, want to stay in our homes where we have our entertainment, our medication, our pets, and our family, or we may even have disabilities or economic reasons we can't leave. So again, this is why the emphasis is on residential home and retrofit. All right, I'm going to stop there. And Andy, this is Dr. Andrew Chang Young, and I believe you should be able to go ahead and share your screen.
Okay, let's see if I can get this to work.
Okay,
my apologies,
there you go.
Gillian. Yeah.
Yeah, I just fixed it. It was on my end.
Okay, no worries.
You should be good.
Can everybody see the slide okay? Coming up okay?
Looks great.
Perfect. Okay. Well, I just wanted to say a big thank you to Gillian, the Tribal Healthy Homes Network, as well as the Tulalip Tribe for inviting me to give this talk today. My apologies. I will unfortunately have to leave shortly after this talk, but I'm available by email, and Gillian will share that email as well too for additional questions that may come up later on in the seminar as well too. So my name is Andy Cheng. I am currently I'm trained in cardiology as a clinical practice, and I'm currently a advanced cardiac echocardiography fellow physician, quite the mouthful, at the University of California, San Francisco. But in my research career, I'm also a postdoctoral research fellow with the Stanford Cardiovascular Institute, as well as a doctoral candidate with the Department of Epidemiology and Clinical Research at Stanford. And my personal and investigative interest is in the impacts of climate change and environmental forces on the cardiovascular health of older adults. And so I'll kind of be talking a little bit, dipping both into the clinical as well as the epidemiology realm to chat a little bit about the impacts of climate change on our older adults and elders as well too. Before I launch into it, I do want to mention some disclosures. I'm employed ad hoc by the federal government, so I do provide some clinical services on and off for the VA hospital system here in Palo Alto, but I don't have any commercial conflicts of interest to disclose. And when we're talking about older adults, usually we're talking about the ages is sort of in the 60s, so the sixth decade of life. But there is a transition that happens on a biological level for individuals, really beginning in the fourth and fifth decades of life. And that's associated with a bunch of changes that really happen at the molecular, cellular, and even tissue level changes. And I'm not going to go into too much detail about what those entail because it is very complex. But there's lots of interactions with all the different environmental and nutrition factors, stresses, as well as underlying genetics. And as you can see, there's a lot of different biological factors. To distill them mostly, there's genetic issues in terms of damage to the underlying DNA, but also the inability to repair the DNA, and then cellular senescence, meaning sort of a molecular level breakdown of our tissues as well. And all of these changes really take their toll over the first 4 or 5 decades of life, to which we actually start to see an increase in these important high morbidity and high mortality chronic diseases that start to take hold. This is a graph from the National Cancer Institute from their SEER Explorer visualization. And what you can see is the y-axis is showing new diagnoses of all types of cancers. And you can see that it's pretty flat, and there's sort of this inflection point that really happens right around 50 years of life and then takes off from there. And so you could see the impact that has. And that's replicated again for a whole host of different chronic diseases. So on the right side on this graph, you could see for arthritis, heart disease, cancer, diabetes, and chronic obstructive pulmonary disease, that they all follow this same kind of distribution. And this is from a textbook by Harris and colleagues. And I like that they also included asthma here, which is often considered a disease of children and of youth. And you can see that it remains stable and even levels off towards the older age categories as well too. So there's clearly something happening at an underlying cellular and molecular level at this time period. Now, this is really important because the population of individuals that we would consider to be elders or older adults is really increasing, and it's already a pretty substantial number. So back in 2019, with that census, there were already 750 million people in the world who were already over the age of 65. And that number is expected to more than double by 2050. And so essentially 1 in 6 people all around the world will be over the age of 65. So there's a large population and a growing population that we're talking about. And so there's specific climate-mediated health concerns for this group of individuals. And I'm going to start by talking about the concerns first, and then talk about some of the biologic and social vulnerabilities. And so I know today's session is a lot about extreme heat, but just as a broader overview, there's an increase in ground level air pollution, as well as an increase in wildfires that's associated with climate change. And part of that has to do with changing wind patterns. So there's sort of stagnation in many parts of the world, particularly urban areas. And so we will see increases in ground level air pollution. But also, as you've seen, there's hotter, drier summers that are also interspersed with wetter winters and growing seasons. And the net result from all of that is that we're going to have not just more frequent, but also more intense wildfire seasons. And I live in the Bay Area in California. And so this was actually a regular occurrence for us, really, on an annual basis. And unfortunately, this past year, many of our colleagues in the Midwest and even the East Coast and New England also, unfortunately, got accustomed to seeing skies that look like this as well, too. And air pollution is a major issue. There's over 7 million deaths that are attributed globally to air pollution each year, making it the single largest environmental determinant of human health. And again, half of those 7 million deaths are in older adults over the age of 65 years of age. And as a cardiologist, this is something that's of great interest to me because over half of those deaths, again, are due to heart disease and stroke. And it's not just wildfires and acute deteriorations in air quality. Also, long-term air pollution has been associated with things like asthma and chronic lung disease exacerbations, but also heart attacks, heart failure, cardiac arrest, and stroke. And it's not just heart and lung conditions as well, too. Long-term exposure to air pollution is associated with a whole host of cancers, unsurprisingly, lung cancer being prime among them, but also diseases like dementia, osteoporosis, and frailty, which are major concerns in our geriatric population, also are associated or are worsened by air pollution exposure. Switching gears a little bit and talking more about extreme heat and heat waves, again, unfortunately, this summer, I think many of our participants here, even in temperate regions of the world, have been exposed to quite a few heat waves or high heat events. And the death toll, unfortunately, for that is quite high. At least 2,000 deaths annually in the United States alone can be attributable to extreme heat. But that's not to say that they can't be worse. There's exceptionally severe heat waves in unprepared populations and situations as well, too. And an example of that is the European heat wave that hit Western Europe in 2003. And it's estimated that up to maybe even 70,000 fatalities were associated with that extreme heat event. And that makes extreme heat deadlier than hurricanes, floods, blizzards, and tornadoes combined as well, too. And again, as Gillian mentioned before, the majority of deaths in those extreme heat events are in older adults over the age of 65. And cause of death from extreme heat exposure is largely cardiovascular, so heart disease issues. To give you an example, going all the way back to 1995, there was an analysis of Chicago heat wave mortalities by the Mortality Register. And it was interesting to note that only about 5% of those deaths were directly attributed to heat stroke, while the vast majority, almost 94% of excess deaths listed heart disease as a contributing underlying factor. And it's believed that possibly up to 2/3 of mortalities from this other 1995 and 1997 Midwestern heat complex were often directly precipitated by cardiovascular causes. And there's biological basis for this as well, too. So serum troponins, troponins are a blood stress protein that you can actually detect on blood tests in individuals. And if you see an elevated serum troponin level in the blood of a individual with heat injury, that in and of itself, if you know nothing else about the patient, is an independent risk factor for having a negative outcome from heat exposure and heat injury. So to briefly touch, as was alluded to before, climate change is associated with a whole host of different environmental dangers to older adults, but a few others that are worth noting are hurricanes, flooding, tornadoes, winter storms, and blizzards. This is really tragically illustrated with Hurricane Katrina, where almost half of the deaths attributed to Hurricane Katrina were in individuals over the age of 75. And it's not just effects and directly coming from the hurricane, like trauma and displacement, but you can actually detect spikes in heart attack rates in inpatient centers following major hurricane events. And the effects from that can even persist in years. This is a group out of Louisiana that tracks some of these outcomes and shows that even in the years that follow a major hurricane like Hurricane Katrina, that you could see an elevation in heart attack rates. And I'm not going to go into too much detail, but we speak a lot about extreme heat, but extreme cold in the form of major snowstorms have long been known to be associated with spikes in heart attacks, both heart attack attributable deaths as well as admissions. And I think we'll see an increased interest in this as climate change not only makes hotter summers hotter, but also will result in extreme cold events during winters as well too. And older adults are disproportionately affected from disasters and evacuations from natural disasters. There's lower mobility, and I'll touch on that a little bit more as well. And a quick note about sea level rise, because a lot of our communities are coastal dwelling populations, but something that we haven't really spent a lot of time researching or understanding better is what the impact is going to be in terms of groundwater encroachment. So as the polar ice caps melt, we are noticing that the sea level is rising, and what we'll actually see is that there's seawater that's entering the drinking water supply through the ground. And that will increase the salinity, so sodium content of drinking water. And we do know that sodium is a very potent cause of increased blood pressure. And so this is something to keep an eye on as we go forward, as people be exposed to higher and higher levels of sodium in their drinking water. And then epidemic and pandemic disease, I don't want to spend too much time on this, but we do know that older adults are both more susceptible to infections and less likely to be able to mount an immune reaction from vaccines. And we saw that very tragically illustrated during the initial outbreak of the COVID-19 pandemic, where our nursing homes really were the ground zero, both in terms of large numbers of cases as well as high mortality rates. And so switching gears again, wanted to talk a little bit more about what it is about the aging process at the organ level and at the physiologic level that really increases vulnerability to these environmentally mediated climate change health hazards. And so kind of breaking it down by organ system, we'll work our way from the top to the bottom. And so in terms of the brain, we know that dementia increases with aging, but it's not only is dementia itself a predictor of having a worse outcome from being exposed to air pollution. There's mounting data to suggest that air pollution itself can actually cause or accelerate the course of dementia as well too. At the level of the heart, I did want to make a special note, especially because this is a session on extreme heat. But to take a step back, I wanted to talk a little bit about why the cardiovascular system is so affected during an extreme heat event. And the reason for that is because when the body is overheated, the way it cools off is by redirecting blood from the center of the body, which is in the gut, in the kidneys, in the center of the body, and redirecting it to the surface of the body, to the skin. The reason for that is because when you can get that blood to the surface, then it comes closer in contact with the ambient air, and that allows heat to passively be reduced. But as you can imagine, this requires a lot of work in the circulatory system because the heart has to pump harder, the blood vessels have to constrict and essentially redistribute that blood volume of many liters and get it towards the surface of the skin. And aging is associated with reduced myocardial contractility. And what that means is that the heart muscle itself does not pump as vigorously as it did in a younger individual. And so that leaves older adults less capable of facilitating that process of moving blood from the center of the body out to the skin. And not only that, if you're exposed to heat, you're more likely to be dehydrated. So your circulating blood volume decreases. So in both of those scenarios, the heart is less able to compensate with the aging process. In addition, older adults are more likely to be on medications, such as diuretics for things like heart failure or kidney disease or high blood pressure, or beta blockers, again, for heart diseases and high blood pressure, which are intentionally blunt the heart's squeezing ability. And we do it in the clinic because we wish to protect the heart from overactive adrenal hormones or from the impacts of too much stress. But in the very heat-stressed individuals, that can blunt the compensatory mechanism. At the level of the lungs, aging leads to impairments in the function of the pulmonary vascular barrier, and that's basically the small blood vessels in the lungs where air pollutants first enter the bloodstream. So if you have a weaker barrier function, more toxins are able to enter the bloodstream through the lungs. And then at the level of the skin, with the aging process, there's reduced thermoreceptors. And so what that is the skin has small sensors that allow us to allow the body to sense heat. And with the aging process, we lose a lot of those sensors, which reduces the body's ability to kick in those regulatory mechanisms I talked about against both extreme heat as well as extreme cold. And older adults also sweat less. There's less overall sweat production. And more importantly, there's less effective sweating. So there's less sweating coming from the core of the body where the heat really needs to be dissipated the most. And then finally, like I mentioned before, the blood vessels that are in the kidneys and the gut really struggle to constrict, to redirect that blood flow from the center of the body to the surface into the skin. So with a little bit of our remaining time, just do want to talk a little bit about the aging related social vulnerabilities, because it's not just the biological aspects that make patients more older adults more susceptible to climate change. There's economic vulnerability, as was mentioned. A lot of our elders are on fixed incomes. There's the social isolation aspect. Even if they're non-institutionalized, older adults are more likely to live by themselves. And then there's lack of mobility and transportation resources to evacuate from hazards as well too. So institutionalized elders who are in group living situations or in nursing homes are constrained oftentimes in terms of their mobility. Independently living older adults are less likely to be able to drive themselves, both because they do not have cars or no longer have a driver's license. And finally, they're less able and oftentimes less willing to evacuate during disasters. And then finally, access to personal protective measures is also reduced as well, because older adults are less likely to live in air-conditioned homes. But even when they live in units with air conditioning, they're less likely to use them. And oftentimes there's the citation of financial barriers, like I mentioned above, perhaps from fixed incomes that limit their ability to use air conditioning. And then, as I mentioned before, older adults are more likely to be on these very important medications that are left behind during evacuations. I don't think I have too much time, but just a couple quick considerations that are specific to tribal elders. Unfortunately, Native American populations and older adults do disproportionately live in harm's way from environmental climate change related hazards such as wildfires. So this is a paper out of the Masri group looking at the state of California and census tracts by the average percent of the census tract that was burned during wildfires. And what you can see is that Native American individuals who are in these red triangles are disproportionately represented, especially in rural areas in regions of high percentage burn during wildfires. And then in the bottom two panels here, what you can see is that the light blue dots here represent individuals who are over the age of 65, and they similarly are overrepresented in regions with a high acreage that was burned. First Nations elders are also disproportionately suffering from evacuations, which take them away from ancestral lands and ancestral ways of life. I won't go through this, but this is a very impactful quote from an interviewee from the Sandy Lake First Nation in Ontario during a evacuation in 2011, where he noticed that his mother, even when there was food, was unable and unwilling to eat. Language barriers were a major issue. Displacement from ancestral lands was also a major issue. And I won't spend too much time, but long story short, I think we have to be cognizant, however, that older individuals should be involved in the decision-making process and in the development of strategies to mitigate climate challenges, that we shouldn't simply think of our elders as victims. And the reason for that is because there's a concept called legacy thinking that I really like. And what legacy thinking is this mental resiliency that comes from the ability to think outside of one's own generation or outside of one's own individual experience. And that can come in the form of community leadership, family cohesiveness, and the ability to mobilize social capital, and sort of this longitudinal perspective of having survived or lived through previous natural disasters. And in fact, older survivors of the Hurricane Katrina event did frequently cite that having survived prior hurricanes as being sources of strength for surviving this particular hurricane event as well too. And as I mentioned before, our elders have an amazing capacity to think outside of themselves and really think about children, their children's children, and future generations, which can have huge impacts in terms of setting policy for multi-generational threats such as climate change. So I just kind of want to leave it there and maybe open it up for a few quick questions. And just wanted to say thank you, everybody, for listening to the talk and for the invitation to speak today.
Thank you, Dr. Cheng. That was spectacular and right on the mark. I appreciate it. I'll be digesting that information for a while. And let's see, if we go to Q&A, I'm going to see, it looks like there's a conversation about heat pumps in the Q&A. We do have a contractor and former intern, Abby Nelson, online right now, who's available to facilitate. So Abby, do you want to unmute if you see any direct questions here?
Yeah, hi everybody. I don't see any direct questions right now, more a comment that somebody was reading an article about how humans need to cope with heat and stress as they age, and the key is to stay in shape. So they're trying to get their steps in. So that is the only question that I see right now.
Okay, great point. Thanks, Abby. Let's see, I'm going to go ahead. If you want to, I'm going to introduce Ashley Schmidt, who is our next speaker. And Andy, you teed it up very well, because Ashley is actually, risk communication is sort of this public healthy term. But what I like in here in my Native colleagues is about listening and listening to elders and keeping that conversation open. And Ashley's work, from the time that I've worked with her, seems to echo the idea of that communication and that direct understanding. So go ahead and take it away. I'm going to mute myself, and Ashley, you're on. Oh, wait, I apologize. Little gap. I have Ashley's questions. So what we're doing with Ashley today, you guys, this is what we did at a conference recently. I'm going to interview her because her stories and her observations are really rich and really powerful. And just briefly, this is the bio on Ashley. Again, for those of you, if you can't access the landing page, I'll leave this up for just a moment. But clearly a rich and interesting background that has led her to do some great work with the Tulalip tribes. And she will now, I'm going to ask her a series of 2 or 3 questions related to our conversation today. So the first one, Ashley, this is a photo of Ashley in the field, is from your experience working with Tulalip elders. What are some of the cultural or generational factors that we should always keep in mind when doing risk communication during heat events?
Yes, thank you so much, Gillian, and hello, everyone. I'm so thankful to be here and to be sharing some of these stories and insights. And I also want to thank Dr. Cheng, because everything that he covered was also very, very useful to always have in our back pocket. And I really loved how he kind of ended that keynote, talking about this idea of legacy thinking. And so I'm going to really kind of lean into that as I answer this first question. And at the very, very beginning of this presentation, you saw a screen that said, elders are our greatest community resources. And working here for Tulalip tribes in the community health department as a community health nurse for almost about 4 years now, that statement is truer than true. And I am reminded that very, very humbly every day working here. Elders are our greatest community resources. And even diving into that and deconstructing that sentence a little further, I urge you, wherever you're sitting today and whatever community or population you serve, to think about the elders and the aging population there, and think about how, exactly what Dr. Cheng was just speaking to, that elders really do embody the community in which they come from. They hold innate resources within them. They have survived natural disasters in the past. In particular, with tribal elders, they have survived more than most of us can imagine, both in emotional, psychological, and physical hardships. And they're here because they are resilient. So we tend to hear quite a bit with tribal communities, Indigenous First Nation communities, and really all BIPOC communities that there's historical trauma, and we need to understand, acknowledge, and respect historical trauma, which is very true. But I also urge you to look at it as historical resilience, particularly when we are working with our elders, our tribal elders. There is historical resilience that should be celebrated, that should be honored. And so that's kind of where I like to lead from. You know, what are some cultural and generational factors to always keep in mind? That they are the culture and the generational factors, right? So lean into the existing knowledge that these elders come to the table with before assuming that they need to learn how to make a smoke safety room or learn how to mitigate these health risks with extreme heat or smoke events. That is true. Yes, you will get there. Yes. But first, always take a step back and lean into the existing resilience, the existing lived experience. They have good teachings. We as Native people are raised to listen to the teachings of elders, and this particular topic and risk communication is no different. That is always where we try to start. Also, relationship build. You'll get nowhere with tribal elders without a really foundational foundation built out of very strong trust. And we lean into that and know that, knowing that there is a historical distrust in modern medicine, in colonization, in Eurocentric viewpoints. So if we're coming in with high level stats or the scare tactic, a fear tactic, that may be counterproductive. And so what we should always begin with as well is coming in as a harm reduction mindset. How can we meet them where they are at while not leaving them there, right? So we understand, as for myself as a community health nurse or as a public health provider, social worker, researcher, you know, you're coming in knowing that there's maybe a give that we want to have them take away, but what can we take away from them as well? What can we learn from their existing strengths, right? We're going to come at it from a strength based instead of seeing something as a deficit. There is no deficit with tribal elders. There is only strength to build upon. And I think that's probably, yeah, there you go.
Yeah, there you go, Ashley. Oh, my question. What services, Ashley, do you provide to Tulalip elders? And within that work, where do you see opportunities for addressing these growing risks of heat, smoke, and infectious disease?
Sure, thank you. So here at the Tulalip Tribes Community Health Department, we offer quite a bit of services to the entire reservation and particularly to the elder population. So I'll try to do a nice high level overview of our department in a whole and then kind of narrow it down to the services that my team provides. So as the community health department, we are one little office, just kitty corner to the Tulalip Health Clinic. And we are led by an executive director and a director. Both are tribal members. One is a tribal elder. And with them, I mean, I like to highlight this because our leadership starts with 50 years plus of combined experience, let alone a tribal elder that we can lean into and understand that niche population just working with them. Something else that I like to bring up, you know, that being able to work alongside tribal members while also serving their own community, they are able to bring some of that piece of knowledge too. So for example, I was just in a meeting the other day and something one of our director mentioned was, I have lived in this zip code my whole life, maybe with the exception of about 6 months. And that is a powerful notion to work from, right? So as someone who serves this community, to understand that this is the home, to what Dr. Cheng was just saying, you know, a tribal elder was displaced and was hungry even though there was food. Well, that's probably because she has never been, sans, being displaced years and years and years ago, that this is their foundation and their livelihood, and we have to understand that as we come in. But I digress. So we're led by an executive director, an amazing director, and then underneath that team of leadership, we have some very solid services that we offer the community. For example, caregiver services. So for homebound or semi-homebound tribal members, we're able to partner with some local caregiving agencies and offer caregivers in the home. Most of those are elders. Transportation team, we have a very robust transportation team that provides rides to and from non-emergent medical appointments with priority given to our tribal elders. And of course, having a wheelchair van to serve anyone that is wheelchair bound. We have a registered dietitian, WIC and SNAP Ed program within our building, which also they work highly with our elder population and all of their families within. We have a lot of caregivers to young children, so grandparents that are now serving as guardians for their grandchildren. They work closely with our nutritionist and of course the SNAP Ed program. And then of course, my team is the community health nurse team. And within that, we have community health nurses and community resource coordinators. With a full team, I would have 4 nurses and 3 resource coordinators. Currently, we have 2 nurses, which I'm really excited to say that because I was able to hire a new nurse here within the last few months, and 2 very hardworking community resource coordinators. Within that small team, we offer care coordination services, hospital follow-up services, which means we go visit if we know about it, that's kind of a hard funnel to work with, but we try to serve all of our tribal members in the hospital, make sure that they know that the tribe knows they're there so that we can step in for advocacy if there's any unsafe treatment going on, or they're not receiving the care that they feel that they deserve, or tests that they feel that they need. We do general public health education campaigns, vaccine clinics, tabling events, public health education. We work within the schools. We work within all the other different departments. We are an arm of the Tulalip Health Clinic. So because of that, we kind of fit under the umbrella of the Tulalip Health system, which is great because we're able to offer a wraparound service for all tribal members, not just elders, for all families. And the way that we like to look at that is we're really wrapping our arms around them. We're walking beside them. And then one that I'm very, very proud of is Elder Wellness Service. And so that really is kind of a health monitoring service, but we're here to address self-isolation. We're here to make sure that we are, quote unquote, putting eyes on our elders on a regular basis, those that may not be seen out and about in community as often as they used to, particularly as we're transitioning out of this pandemic. That was a huge concern. Hey, we haven't seen so-and-so come out of their house. Or for example, we have partnerships with other departments that tell us, hey, we haven't seen their garbage out on the street to get picked up in a couple of weeks. Maybe we should go knock on their door and check on them. Or the pharmacy contacts us and lets us know that they haven't been able to deliver meds, new medication to a new patient or to an elder, and what are their concerns there. And we work through our networks and through the relationships we've built with their family or with that elder themselves to be that voice and to be that in as an arm to all of these other services that are also trying to give good work and good medicine to these families. We have other outreach and efforts that we are always constantly working off of. So particularly in the thought of natural disasters or extreme heat and smoke, we absolutely go down our entire elder list that our leaders keep up to date. We split that up. We call them, we check in on them. We urge family to check in on their elders. We urge the trusted providers like pharmacists to be having those hard conversations with them. So again, we lean into these relationships that already exist to be able to build upon all of these messages we're trying to provide.
All right. This time I remember. The third question for Ashley is, are there specific programs or departments where you see the potential for increased collaboration, specifically, of course, during an extreme heat or extreme smoke event?
Yes, and I am definitely very biased here, but what I like to believe is that community health should be at the table for everything. We are some of the best boots on the ground and ears in the wind, and for all the points that I just mentioned, right? We are building those relationships over time. We have that consistent place, with the entire community, and so building upon that, like I said before, can really, really strengthen the work of other departments or just build it up, right, and make it more robust. So breaking down silos is a huge need in all areas, I think, of any government, but particularly tribal governments. And being able to be the team that might bridge those services is extremely important. And we've found some really great success here in the Tulalip community doing that. So for example, we have a seat at the table with some of our really powerful housing initiatives where they like to meet on every neighborhood. So they open up a neighborhood forum, kind of like a town hall meeting for all of our housing neighborhoods, and community health along with other departments get to attend and hear what are the concerns. Is there something that community health can step in and help address? Is there already something we're doing that can help address these concerns? Another really fun initiative or collaboration, I should say, that we've been involved with is emergency management. So we've been at the table during the Washington State 2022 Cascadia Rising exercise with emergency management. We've helped create and disseminate how-to videos with all these different departments, including tribal healthy home networks, and be able to provide, hey, this is how you create a smoke safe room. This is how you pack a 72-hour emergency kit in your home. This is how you use a fire extinguisher in the event of a fire. And they're quick 1-minute videos that we get to disseminate out to all of the masses and also go door to door for our elders and really meet them where they're at. Another really exciting project that I'll just plug in is our Container for Life project. And that is a direct product of a really strong relationship that we've built with the Tulalip Bay Fire Department. So being able to be partners literally in the field during medical emergencies and having that respect between teams has been life-saving, to be quite honest, for a lot of our membership. And the Container for Life project is a project that addresses the agency and autonomy of a tribal member in the event of a medical emergency. So we give them the tools that they need in the home so they can answer questions for themselves in the event they need to call paramedics to the home. It's not left to the family to answer questions on their medical conditions. It's not up to their loved ones to know which medications they are supposed to be taking or have taken. And it also gives them, like I said, that agency to speak for themselves. Cultural considerations, hospital preferences, how to spell their name correctly, how to say their name correctly. So, honoring the tribal elder voice and giving them a voice in those times is possible. And it's really only possible if you have those built collaboration and relationships with other departments.
All right, Ashley, I am as impressed as always. And what I really like is how much she's focusing it on an elders first in building her programs. And I'm not using enough words to capture how well you said that, but that's my summation. I don't know if we have time to play the video. Did you want to put a link to it in the chat by any chance?
So I don't have the link on hand, but I can read the story because I have it typed up.
Yeah, we've got about 2 minutes. Does that work?
Oh, sure. I can read fast.
Okay. All right. All right. Go right ahead.
So really fast, during the emergency management table exercise with the Cascadia Rising, and for those that don't know what that is on the call, it's a kind of a simulation practice for the next Cascadia subduction zone, or some of us may have heard that as the big one right here in the Pacific Northwest. During this exercise, as a community health nurse and someone who really likes to lean in to strengths existing within the community, I'm thinking to myself, okay, you work for Native people, you work in Indian country. We all know that Native communities have been in this area for time immemorial. So let's look back at the last documented major seismic activity in the area. And I found that it was around 1700. So I'm thinking, okay, now let's take it a step further and see if there are some coastal tribes that have oral traditions, because that's something if we want to message things, message risk communication to a indigenous population, we have to build it upon existing knowledge, right? Or relate it to something that their ancestors and their elders have also experienced and survived. So I was able to find a beautiful oral history from the Ho Indian tribe, and I'm going to read it for you. It's the story of the Thunderbird and the whale. The Thunderbird lives in the glacier at the headwaters of the Olympic Mountains. The whale we all know lives in the Pacific Ocean. When the Thunderbird comes out, he may not even be looking for a whale or whale hunting, but he'll go out to the sea. Usually we can hear him coming with the thunder and the lightning. Grandfather used to say, he's coming, we can hear him. He's going a long ways, he's not stopping. When he gets to the water, he'll flap his wings, and if he flaps them hard and goes down, the water will come up and cause the tsunami. And the faster and the harder the Thunderbird comes down and lifts quickly, the wave will be bigger. But if he's going far away, we'll barely hear the thunder and see the lightning. These stories we have listened to and believed them. We feel the ground shake. We're told in our language to run to high ground or get away from the ocean because it's dangerous. And that's it. I mean, that's as simple, and I shouldn't say simple because it's not, it's the most beautiful oral history that I've been able to find on, looking at a historical natural disaster and how these communities responded then and passed them down generation to generation. So I urge everyone on this call to look at that, go to the history books, talk to your First Nations and Indigenous communities about what have they learned through generations and what are those oral histories, because I can guarantee you there's something there that is already risk communication based that you can build upon.
Amazing. Absolutely amazing. And when Ashley was presenting this at a conference, a woman stood up from the Ho tribe, and that elder who had relayed the story had been her aunt or grandmother. And, it moved everybody to tears. It was a coincidence. It was amazing. Ashley, thank you again.
Thank you.
Ashley's contact information will be in the final slide. We are now going to go into the mechanical side of this. So Eileen Gagne, who is a robust expert on upgrades, retrofits, and interventions. She's our circuit rider trainer. Just know, again, if you are one of the tribes out there in Region 10, we have funds to bring her out directly to do one-on-one training with housing, maintenance, air quality, community health. I'll let her take it from here. Again, briefly, here's her bio. Here's a picture of her at Tulalip doing some outreach. We're still not sure why she's not wearing a mask. She may have just taken it off for a moment. But outstanding speaker. And Eileen, I'm going to go ahead and mute and let you go ahead and just tell me when to advance the slides.
Will do. And thank you. And thanks to the Tulalip tribes again for all the support for doing this work. So I'm going to talk about the housing factors that contribute to high indoor temperatures. But first, I want to give you all a little bit of a background. So Gillian, you can hear me, correct? Just want to make sure. So everybody can hear me? Just give me a
Yes.
thumbs. Okay.
All good.
Okay.
Yep.
So I've been working in homes for over 40 years, and it started when in the 70s, yes, I am dating myself, when there was an oil embargo, and I started thinking about energy efficiency and insulating and weatherization and everything that's coming up now. Then, unfortunately, I made a very sick home because we didn't understand all the mechanics of indoor air and building science. However, things have changed. So 25 years ago, I bought a 1906 house in Seattle. In 2013, my energy bill for my oil heat, electric baseboard heat in some rooms, my water heater, and all my energy use was $3,100 for the year. Now, in 10 years, I have used whatever rebates, whatever I could find, low interest loans, whatever. So in 2023, my energy bill for heat, air conditioning, hot water, and energy was $86 for the year. And I'm going to say that again. It was $86 for the year. Now, what I'm going to do is talk to you about all the Inflation Reduction Act fundable upgrades that I'm going to present to you that you can use in your own home. All right, so so my point is this, and this is what I did, was I took a home that was an energy desert and just an energy suck and turned it into a climate resilient and energy efficient home, which is what we all have to do. According to the stats I found online, 90% of the homes that exist currently are built before 2010. Though all those homes are going to need to be retrofitted and remediated to become climate and energy resilient. Next slide, please. So the first thing we got to start with our site. Now, this is a perfect example of the worst kind of landscaping you could possibly put a home in. There's no greenery, there's no trees, there's no way. It is a heat desert. And it is a heat island. So these houses have no way of getting cool other than opening windows and letting warm air in. There's lots that can be said about this. We're going to move on to the next slide. So, but we've also seen a lot of substandard construction, older housing stock, and a lot of housing that has not been remediated and gone through a lot of deferred maintenance, meaning it has not been kept well at all. This looks like a pretty nice house, and this looks pretty standard for the homes that I've dealt with up at Tulalip. You know, it's 2-bedroom, 1 bath. It's got a laundry area, a living room, a dining room, and a kitchen. However, up at Tulalip, as you heard from Dean, the water table is so high that in these crawl spaces that they put in, there can be a foot to 3 feet of standing water any time of year in those crawl spaces. These houses were not designed for Tulalip. They were not reflective of what needs to happen and what needs to happen culturally and environmentally, and things that are appropriate for each and every location. Next slide. So here we have, and you've all seen this, old and inefficient heating and cooling systems. You got baseboard heat, you got wall heaters, and you have window air conditioners, which are a huge contributor to greenhouse gases. Next slide. So a lot of these homes also have little or no insulation in the ceiling, walls, and crawl spaces. Not only is the insulation, if it's there, but it's old and it's been compressed and it needs to be updated, it needs to be changed out. A lot of the insulation also can contain asbestos. That's a whole nother conversation. And it's never been air sealed. Aging roofs, you've got lots of old roofs that have not been upgraded or changed out. Some have had multiple layers installed over it. You've got missing shingles, and leaks, which can lead to mold inside the walls, which can lead to health effects. Next one. You also find leaky, ill-fitting, and uninsulated doors. So here we see, you know, there's actually chipboard, which is a type of plywood that's been installed on the floor. And I don't know what's going on with that flashing or the flooring itself, but they've had leaks. You can see the water damage. And once again, it's not housing that has not been well taken care of and upgraded. Next. Single pane or broken double pane windows. This is classic for older housing stock. You've got single pane windows, and here you have glazing that's falling apart, not to mention possible lead-based paint. Double pane windows where the seals have been broken and basically they're down to single pane windows, which is a huge energy loss to heating and if there is air conditioning. Next. So bath fans, in a lot of codes up until recently, there could either be a fan or a window in a bathroom. Well, you know, let's say the fan isn't vented out. Has it been cleaned? Has it been upgraded? Is it noisy? If it's noisy, does it even work? It may sound bad and it may sound like it's on, but does it really exhaust moisture and fumes? Who knows? So, and then kitchen fans, is there even a kitchen fan? Sometimes it just vents into the wall cavity. Does it even vent outside? Next slide. So all of the retrofits and upgrades that I'm going to talk about here can be Inflation Reduction Act funded. The multiple aims of these are not only energy efficiency, but affordable, climate resilient, and healthy. Next. So in the IRA, $361 billion directly goes to communities through federal agency grants and loans. $9 billion goes directly to the consumers at a point of purchase, rebates, or tax credits. Next. So, next slide. There we go. So this has come up is the EACH framework. And so it's a framework for selecting IRA funded retrofits and upgrades. So we're looking at energy efficient, affordable, climate resilient, and healthy. They've got to work in tandem. It would be great if they all worked at once. Like you see in this slide here, these are all, once again, the IRA eligible upgrades and retrofits. So you see air sealing and insulation, both are weatherization, windows and doors, energy audit, kitchen and bath fans, ductless mini splits or heat pumps, and you work your way right down this list, even to indoor air quality testing. And it works across the board and talks about each one of those and if they are energy efficient, affordable, climate resilient, and healthy. Next. So, first and foremost, when you are looking at doing any kind of upgrade to a home that for energy efficiency, you have got to have an energy audit performed. What this is there is a person that comes out with some of this equipment that you see there and evaluates your house based on using infrared cameras, a blower door, duct blasters, airflow hoods, all these things to see how well your house is energy efficient and will actually give you a written form on where your deficits are and what would be the biggest bang for the buck. Next one. So after that comes air sealing and insulation, otherwise known as weatherization. Which is the process of improving the energy efficiency and performance of your home through numerous strategies. It will increase your comfort, safety, and indoor air quality. Next one. New ventilation, both bath and kitchen fans. You've got to exhaust your fumes and moisture. So in the kitchen, obviously, having a fan above the stove that ventilates to the exterior will help to exhaust all the things that are cooking and creating all sorts of chemical reactions, which is a whole nother conversation. And obviously in the bathroom, minimizing and reducing the amount of moisture that remains in the home is critical to reduce the amount of mold that can grow. And Energy Star appliances, including fans, can use up to 60% less energy than standard fans, which is going to save you money in the long run. Next. New windows and exterior doors. Windows are responsible for up to 25 to 30% of heat loss or cooling loss. Upgrading can save $125 to $340 per year in energy costs alone. Next one. And then your heat pumps. So you all probably have seen these ductless mini splits. And actually everyone on this call, unless you're off the grid, probably has a heat pump in their home. It's otherwise known as a refrigerator. Ductless mini splits and the heat pump systems work on the same principle as that. So it's an exchange between outside and indoor air using a coolant, and they are 3 times more of energy efficient than generating heat from wood, oil, or gas. So what you'll see is on the outside of homes is a compressor, and that which extracts the heat from the outside air and then transfers it to the inside. And then you'll see the heads on the inside of the home that distribute the heat or air conditioning to the rooms that it's been installed in. There is a caveat with these. The only filtration system they have is really, the filtration system is to protect the equipment, does nothing for the occupants. So if you put one of these in, you are going to have some kind of a portable air filtration system, which the IRA can also support. Next. So in terms of the IRA eligible upgrades and retrofits, in the boxes in the green, so these are given your point of sale and tax credits. all of these examples, so your weatherization, your energy audit, new windows and doors, fans, and heat pumps you can get a point of sale rebate and a tax credit. The ones in the blue, the greenhouse gas reduction fund, they're still trying to figure out how to implement them, and they as they roll out, I'm sure you will be kept aware of what they will and will not cover. Next one.
And Eileen, I'm just going to jump in and say, I suspect many of you already heard this, but what the, I think Department of Commerce is working on is that a rebate is great, but if you don't have $2,000, $4,000, $6,000, $8,000 to make that purchase for your heat pump or your windows and doors, so they're making it so it's going to be at the point of sale. In other words, you don't have to come up with that cash in advance, but they're working on it so that the retailer would just be, it's not the right word, but paying for it. So that's an important caveat that is going to make it much more accessible for low to middle income families.
And it's a
Back
critical.
to you.
It's a critical. Thank
Yeah.
you. So the Duck and IRA consumer direct funding, all of the ones in the green box are non-competitive. That is a really huge thing. So you've got the home rebate program, home improvement credit, and the homes rebate program. In the blue box are the grant funding. Now, these are a competitive grant process, and they could also be up for doing things like electrifying a vehicle source of, like your vans or things like that, or putting in, electric vehicle charging stations. That could be used for something different. I'm not Gillian is far more versed on this than I am. So next one. And then I think.
And I'll just say really quickly, the challenge in these two grants on the right, they're abundant. There's a lot of money. Most tribes are going to have access to it, but there's going to be different priorities within different tribal programs and departments on what wants to be done. So I personally would love to have a heat pump and an air cleaner in every single elder's homes, but there's other priorities such as the electrification or diesel emissions reduction. Which is why the competitive part is underlined, because it's going to be challenging competing across tribes and then within your programs as to what gets actually put in the grant. All right.
The same with weatherization. So once again, weatherization meaning, insulation, air sealing, all of that is covered. And then Gillian, why don't you talk about, once again, the grant funding in the blue box?
Just the same thing, that you're going to have a menu of eligible activities in these grants, but the emphasis on electrification and reduction of carbon emissions. And so weatherization and heat loss and energy loss in a tribal housing may be important to the occupant, but it may not be a major contributor, for example, of carbon emissions. So the direct credits and tax rebates are going to be a key vehicle to getting some of this work done.
Thank you.
All right. Oh.
That's the end of mine.
Yeah, and just really quickly, we are down to about 6 minutes. There's short time for Q&A, and I can unmute people. Just want to point out really quickly, again, if you weren't here right when we started, that the next seminar is on wildfire smoke, then infectious disease, then precipitation. In January, when we have exhaled and rested, we will then start a listserv, because the thing that's missing today is hearing from you all, because we know you're out there doing, we heard about Muckleshoot Tribe in Washington doing net zero and using indoor air plus. And so there's practices like that happening all over the country, and there's questions, best practices. So we're going to start a moderated listserv just on climate ready housing for elders. Here's our contact information, and I'm just going to pause there. We can turn on our cameras if anybody else would like to do that. Looks like Dean is not, and sorry, Dr. Chang had to leave to go treat patients. Someone else was out of the clinic this afternoon, but he did provide his email address if you have any questions. So anyone else who wants to turn on their camera. And thank you to Abby for facilitating in the Q&A.
Looks like I can't turn my camera on. It looks like only from you. Is it possible?
Okay. Let me see. I apologize for that. This is a new platform I'm using. Let's see if I can. Yeah, I can only make people the posts or the host change panelist appearance. Okay, so we'll just turn our cameras off. Any questions? Go ahead and put it in either the chat or the Q&A.
It looks like, Gillian, there were quite a few questions about heat pumps, especially in Alaska. And thank you, Lorraine, for the Tlingit Haida Regional Housing Authority trains the own installers, which is fabulous. The electricians, that's a problem, boy. And let's see. Yeah, so and heat pumps can work in Alaska. The Cold Climate Housing Research Center in Fairbanks has done quite a bit of research and work on that. And then looks like Kirsten talks about Bonneville Power Administration provides incentives for energy efficiency projects for low-income households, as well as tribal grants. And yes, they do, because we were able to install about 15 heat pumps in elder housing due to a small but effective BPA grant that was matched by the board of directors at Tulalip about 5-6 years ago. Yes. And yeah, it's great.
Yeah.
There's so much, there's the money is out there. The first thing that I really stress people to do is to get an energy audit of the home to figure out exactly where you're going to get the biggest bang for the buck. I know insulation and caulking is not sexy. Solar panels are sexy, but they're not going to really, they will help, but you really need to tighten up the envelope so that whatever you do heat stays inside.
And I'm nodding so vigorously, my head is going to fall off, because by Eileen insulating and caulking her house and sealing off the crawl space during wildfire smoke events, she's getting, maybe 4 to 8% infiltration of smoke. And in my home where that's not done, I'm getting 30 to 60% of outdoor PM is indoors. So there are added benefits. Really quickly, I think Jack Hebert, Vanessa Stevens from NREL in Alaska, they think they were on today. Excellent resource on heat pumps and electrification for anyone in Alaska. I also noticed Bonneville Power Administration, they have been a fantastic supporter of tribes through programs. Tulalip's been able to utilize that for heat pumps for elders. They're also an excellent resource. And then there was just a question about funding for building new climate-friendly homes. There is, and I think HUD, for example, through the NAHASDA, an ONAP would be a great person to ask about how much new innovation you can use in terms of whether it's solar, electrified in your new construction. But I think they're giving a fair amount of leverage now to tribes who are wanting to. The Muckleshoot Net Zero project would be a great one. Ping us afterwards and we can connect you with the people of the Muckleshoot tribe in Washington State, because those are very climate friendly homes. Was an exciting project to see.
British Columbia Housing Research Center put out a fabulous design guide for climate ready housing for new construction. And yes, Passive House is sort of like this. Every house should be this, but the biggest thing is we have got to renovate and upgrade all of our existing housing. That's the big challenge, and especially for elders, the ones most vulnerable.
So we're getting close to time. Everybody will receive a copy of the slides. And if you're registered today, you're going to get an invitation to the next one, and you will get a recorded. And Steve, you've got your hand raised, who's a colleague and climate specialist at Tulalip. Let me see if I can unmute you. I think I can. Let's see here. There's a couple Steves here. There you go. Okay, Steve, I think you're unmuted.
Can you hear me?
I can. Hello.
Oh, well done. Thank you so much for a wonderful presentation. Really, my gratitude to all the speakers. Super excited about the opportunities that we have in front of us with the Inflation Reduction Act. And looking forward to working with the other departments and other communities and trying to bring all those things to bear in improving the homes. So just a shout out and thank you for a wonderful presentation.
Thanks. And Steve's got a good point. Climate and air quality. We were working in our own departments for the last several years, and all of a sudden we're thrown into working together, and it's fantastic. But we're rapidly having to learn new about each other's programs and how we can collaborate. Let's see. We've got Eileen. Do you want to? Please feel free if you need to jump off, have your lunch, have the end of your day. But we're happy to stay here for a few more minutes and capture some of the questions. I see, and also anybody from an agency who wants to speak out about the resources, please feel free to raise your hand. Eileen, do you want to capture any of the other questions or comments here?
It was one about, HUD needs to know because they have to encourage better building homes. I totally agree. But if your house is sealed off, how does air get into vent? So this is the tricky part. You want to be able to control the air and filter the air that comes in. So there are ways that that can be done using various, I guess they're called appliances, where there's a filtration system that is put in the side of the building that actually comes in one side and exhausts the other, and it goes back and forth and back and forth. There's lots of great new technology out there to assist with that. That has been an issue in my house because I've got it pretty well sealed up. It's not 100%. It is better than code in terms of my air changes per hour, but it is leaking. It does leak. The thing is, you want to be able to control where that air comes in your home, because otherwise it's going to come through all the cracks and crevices, through your outlets, through the baseboards, through the wall cavities. And as it does that, it brings all those contaminants in with it. You really want to be able to control that and filter it as it comes in. So that is a great question. So yeah, there are, let's see, there are a couple of green building supply companies that offer, and probably some of the affiliates like the Cold Climate Housing Research Center has some great ideas for bringing in. There's also energy ERVs and HRVs, heat recovery ventilators, and energy recovery ventilators that can be installed in homes that actually bring in fresh air, and it passes over exhausting warm air, which preheats it and filters it. So there are lots of devices that can be installed to provide fresh and clean incoming air. Okay.
And I just made Ashley the host so she can pop on, show her face and say hello and goodbye. Probably should have been easier. Eileen, we can do that with you next. But Ashley, if you're still right there, Phil, I think you can turn your camera on now to say goodbye. Hello and goodbye. There
Can
we
you
go.
see me okay?
See you. Fantastic. Yes.
Man, I thought I was going to go through this without having to turn my camera on. I was like,
I'm so sorry.
No, hi, and thank you
Hi.
all for listening.
All right. Thank you so much again, Ashley and Eileen. I think I can figure this out. It's a little tricky. I have to now take host, but Eileen, if not, let's see here. All right. Well, we'll just stop share. We'll go ahead and Ashley, we're going to probably leave it with you because I cannot. And Dean's here. Thank you very much, Dean. I absolutely have such great respect for these people and for the Tulalip tribes who host and support our programs year after year. And thank you again. And so excited to see you all next month for our wildfire smoke outreach and having the same conversation. All right, with that, we're going to go ahead and end the webinar today. Okay.
Thanks, everyone.
Okay, thanks,
Thank you.
everybody. All right, bye-bye.